Bismillahirrahmanirrahim. Assalamu alaikum. As we have started the series of eye, now our lecture today is positional and structural disorder of eyelid. Okay, so the first disorder, the structural and positional disorder is trichiasis. So what is trichiasis? Trichiasis is when the eyelashes are misdirected toward the eye globe. This is called trichiasis. For example, if this is my eye, and my eyelash turn toward my eye, my globe. This is called trichiasis. Okay. So when this is the eyelash and this eyelash turn toward the globe, this is called trichiasis. Okay. This is called trichiasis. Now, what are the causes of trichiasis? What causes trichiasis? For example, burns, injuries, allergic reactions such as Steven-Johnson syndrome, ocular cicatricial pemphigoid, extensive injuries, etc. So these all can cause trichiasis. Blepharitis can also cause trichiasis. Okay. So these were the causes of trichiasis. Now, what are the signs and symptoms of trichiasis? If the eyelashes touches the eye globe, so there will be when there is the irritation, what will happen? There will be the discomfort, irritation. There will be the lacrimation, photophobia. So it will disrupt the epithelium of the cornea and conjunctiva and will cause photophobia. So irritation, lacrimation, foreign body sensation, photophobia. These all are the signs and symptoms of trichiasis. Now, what are the treatment options? The treatment options are multiple. The goal of the treatment is to destroy and to remove the misdirected lash. So, for example, we can epilate the eyelid. Epilation means to remove. Okay, to remove the eyelash. We can use argon laser. We can use laser to destroy the eyelash. We can use chirotherapy. For example, we can use chiroprobe 8 minus 80 to minus 90 centigrade. We will insert the chiroprobe into the lash follicles and we can destroy the lash follicles. We can use electrolysis. Through the electrolysis, we can destroy the lash follicles. So epilation, argon laser, electrolysis, chirotherapy, these all can be used to remove the misdirected lash. And before treatment, we can also use to prevent this irritation, photophobia, and lacrimation. We can also use contact lenses. The surgical option for the trichiasis is the removal of the abnormal portion. Okay, so we will remove this abnormal portion of the eyelid, of the lid margin. So this was about the trichiasis. Now the second condition is the entropion. Entropion is if this is the eyelid, if this is my eyelid, and if my eyelid turn toward my eye globe. Okay, the trichiasis is the misdirection of the lash toward the globe, but the entropion is the misdirection, the inward movement or the misdirection of the lid margin toward the globe. So the entropion will also cause trichiasis. So the inward movement of the lid margin toward the globe is called entropion. So okay, entropion is mainly of two types. Okay, where should I write? I will remove this. Okay, this will be removed, and this is also okay. So now, okay, so entropion. We have two types of entropion. Okay, mainly it is of two types, which is acquired and congenital. Okay, acquired is further of three types. It is senile entropion, senile or involutional, cicatricial, and spastic. Okay, so Now we will discuss the pathogenesis of each type. What is senile or involutional entropion? Senile entropion is also called involutional because it is related to the age. So senile entropion is more common in the lower lid margin, and it is more common in elderly patient because of the involutional changes in that group of people. So what will happen in the senile entropion? For example, as we have discussed previously in the structure and anatomy of the lid margin, that what is lid retractor. Okay, so take a look through that video. For example, if this is the globe and this is the lid margin, this is the lid margins, okay, and this is the eye globe, okay, this is the globe. Now what will happen? We know that in the upper eyelid, the lid retractor is the molar muscle, okay, and in the lower lid margin, we also have the lid retractor. So what will happen with the age? There will be the entropic changes in different tissues of the body, and lower lid retractor is one of them. So there will be the atrophy of the lower lid retractor, and this will be combined with the stretching of the canthal tendons. So these are the canthal tendon. This is the lateral canthal tendon, and this is the medial canthal tendon. So these canthal tendons, they will stretch out. So the combination of this process, the atrophy or the lower lid retractor, and the stretching of the canthal tendons, the lower lid, what will happen? This is the lower lid. The lower lid will move inward toward the eye. So this is the senile entropion. In cicatricial entropion, what will happen? For example, everything which produces chronic inflammation and scarring, it will induce cicatricial entropion. For example, trachoma, chlamydia trachomatis, which causes trachoma. Okay, as we have discussed previously in the entropion, allergic reactions like Steven-Johnson syndrome, ocular cicatricial pemphigoid, these always will induce chronic inflammation in the conjunctiva, and this inward the conjunctiva, there will be the scar formation, and when the scar contracts, what will happen? When the scar in this is the eyelid margins, and when the scar contracts, it will pull the eyelid inward. So this is the cicatricial entropion. In the spastic entropion, what is happening? That like in the senile entropion, when there is the atrophy of the lid retractor, but in the spastic entropion, there is also the atrophy of the lower lid retractor. But this maybe it is a mild or unrecognized form of atrophy. But whenever there is the irritation of the globe, for example, if there is the foreign body in the cornea, or if there is any if somebody is fingering his eye, so everything which irritate the eye, it will cause the orbicularis oculi muscle to contract around the eye extensively. So because of the irritation, now the lid retractor has, the function of the lid retractor has gone. So it should happen that the lid retractor should contract simultaneously with the palpebral part of orbicularis oculi, but it is not happening. And what will happen? That the lower lid retractor, that the palpebral part of the orbicularis oculi will contract extensively, and it will turn the lid toward the eye globe. So this is the pathogenesis of the spastic entropion. The sign and symptoms of entropion will be similar to the as we have previously discussed the trichiasis, because the lashes are with the inward movement of the lid margin. The lashes will also turn inward, and it will touch the globe. So it will cause irritation, lacrimation, photophobia, etc. So the sign and symptoms will be similar to trichiasis. Okay, so the congenital entropion, it is the congenital deformity of the tarsal plate. Okay, so if there is the congenital deformity of the tarsal plate, there will be the inward movement of the lid margins, and this condition is bilateral, congenital or congenital entropion. Now ectropion is also like this. Okay, similar thing. Ectropion, it is also acquired or congenital, but there is no spastic. It can be senile, cicatricial, but can be paralytic. paralytic. What is happening? What is happening in the ectropion? It is opposite of the entropion. It is the outward. If this is the lid margin, so this is the outward movement of the lid margin away from the globe. This is called ectropion. So when the lid margin, this is the lid margin, and it moves away from the globe, this is called ectropion. It can also be senile, cicatricial, and paralytic. Senile ectropion is, as we discussed previously, that this is also called involutional because it is most commonly present in elderly patient, and it is related with the degenerative changes with the age. So in senile ectropion, what will happen in the lid margin? In the lid margin, there will be the canthal tendons, there will be the atrophy, the connective tissues of the canthal tendons and the muscle, there will be the atrophy. When there is atrophy in this connective tissue, what will happen? There will be the lid margin will laxate. There will be the weakness and laxity in the lid margin, and it will move away from the globe. So this is the senile ectropion. Cicatricial ectropion is like inflammations, like in the entropion, the inflammations were inside the globe, inside the eye, for example conjunctiva. But in the ectropion, cicatricial ectropion, the inflammation, for example, if there is atopic dermatitis, what will happen? There will be the formation of scar. If there is burns or injuries, so there will be the formation of scar. The scar will pull the eyelid outward. So this is called cicatricial ectropion. Paralytic ectropion is now different. So, for example, if we know that the orbicularis oculi muscle has, this is the part of the this is the orbicularis oculi muscle, and there is the portion in the eyelid which is the palpebral part. And this orbicularis oculi muscle is supplied by the facial nerve. So when there is any problem with the facial nerve, it will cause paralytic ectropion. Okay? Sign and symptoms. The sign and symptoms of ectropion is there will be the excessive tearing, which is called epipora. There will be the excessive tearing. Why there is the excessive tearing? Why? This is because as the lid margins are moving away from the globe, and we know that there are punctums in this medial region, and they drains the tears. So when the lid margins move away from the globe, the punctum will also move away, and there will be the accumulation of tears because the tears are not draining. So there will be excessive tearing, which is called epipora. Okay, so this and also because the lid margins are moving away from the globe, so the eye will expose more extensively to the outside environment. So there is the risk of the keratitis and conjunctivitis. Okay, so these are the signs and symptoms of the ectropion.